Margaret Chen was the kind of patient every doctor should dream of. For 11 years, she showed up to every appointment. She followed every recommendation. She took every medication exactly as prescribed. She kept detailed symptom journals. She advocated for herself at every turn. And for 11 years, she watched her body slowly fall apart while her lab results told her nothing was wrong. Today, I'm going to show you exactly why this happened to Margaret. Why her doctors weren't incompetent. Why her tests weren't wrong. And why the same thing might be happening to you right now while everyone tells you you're fine. Because the disease Margaret was fighting doesn't show up in the places doctors are trained to look. It shows up somewhere else entirely. And once you understand where, everything changes. Before I continue, I built something specifically for you. Not just for tracking, and doctor's appointment. It is called Sjogren's Symptom Map, and it walks you through exactly which symptoms to track not just for Sjogren but also for MS and RA. Drop symptom map in the comment, and I would send the link for you to access it. It started the way these things always start, so quietly that Margaret almost missed it. She was 52. A project manager at a logistics company. The kind of person who ran marathons for charity and organized the neighborhood watch. The first thing she noticed wasn't pain. It was dryness. Her eyes felt gritty in the mornings. She chalked it up to staring at screens all day. She bought expensive eye drops. Problem solved. Then her mouth started feeling strange. Not quite dry, but off. Like she couldn't produce enough saliva to eat crackers without a glass of water. She mentioned it to her dentist. He said she should drink more water. She was probably dehydrated. Then came the fatigue. Not the tiredness you feel after a long day. This was different. This was waking up after 8 hours of sleep feeling like she'd run a marathon in her dreams. This was hitting a wall at 2 p.m. that no amount of coffee could climb. She went to her primary care doctor. A good doctor. Someone who listened. He ran a complete blood panel. Thyroid function. Vitamin D, B12. Iron. Glucose. A complete metabolic panel. Every single result came back normal. You're healthy, he told her. Maybe you're just stressed. Have you tried getting more sleep? Margaret went home confused. Because she didn't feel healthy. Not even close. Over the next 3 years, Margaret's symptoms didn't just persist. They multiplied. The fatigue deepened into something she couldn't push through. She had to quit her job. She told people she was taking early retirement. The dryness spread. Her skin became papery thin. Her nose cracked and bled. Her throat felt like sandpaper. And then the pain arrived. It started as stiffness in the mornings, an hour of feeling like her joints were rusted shut. Then it became an all-day companion. A deep, burning ache that moved through her body like weather. Some days it lived in her shoulders. Some days her hips. Some days everywhere at once. She went back to her doctor. He referred her to a rheumatologist, a specialist in autoimmune diseases. The rheumatologist ran more tests. An ANA panel. Rheumatoid factor. Anti-CCP antibodies. SSA and SSB antibodies, the specific markers for Sjogren's syndrome. SED rate. C-reactive protein. Every single test came back normal. Your inflammatory markers are perfect, the rheumatologist said. Your antibody tests are negative. I don't see any evidence of autoimmune disease. Margaret sat in that office, her body screaming at her, and heard the words that would haunt her for years. Have you considered that this might be psychological? But here's what Margaret didn't know. Here's what most patients never find out. Her tests weren't missing her disease because the disease wasn't there. They were missing it because they were looking in the wrong place, at the wrong time, for the wrong signals entirely. Let me show you the contradiction that's destroying millions of lives. On one side, you have patients like Margaret. People with crushing fatigue. Widespread pain. Dryness that makes eating and sleeping miserable. Brain fog so thick they can't remember their children's phone numbers. Nerve symptoms, burning, tingling, electric shocks running through their limbs. On the other side, you have lab results. Clean. Perfect. Normal. And here's the question that should keep every doctor up at night. How can someone have normal fibromyalgia and Sjogren's labs but still experience progressive nerve damage, autonomic dysfunction, brain fog, gland destruction, and functional collapse? This isn't a contradiction. This is a design flaw in the entire diagnostic system. Because here's what medical school doesn't teach: and what most practicing physicians have never been told. The tests they're running are designed to catch diseases in their final stages, not their beginning. They're confirmation tests. Autopsy reports for a disease that's already done most of its damage. They were never designed to predict what's coming. And by the time they finally turn positive, if they ever turn positive at all, you may have lost years. Years of early intervention. Years of slowing progression. Years of your life. Let me explain why this happens. Because it's not that doctors are lazy or uncaring. The system itself is broken. When you walk into a doctor's office with widespread pain and fatigue, here's what typically gets measured. ANA, antinuclear antibody. Looking for antibodies attacking your cell nuclei. ESR, erythrocyte sedimentation rate. Looking for inflammation in your blood. CRP, C-reactive protein. Another inflammation marker. Rheumatoid factor. NECCP. SSA and SSB antibodies. These tests are looking for one thing: evidence that your immune system has already mounted a massive, systemic attack. They're looking for the fire after the house has burned down. But fibromyalgia and Sjogren's syndrome don't start as systemic antibody diseases. They start as nerve diseases. They start as local immune regulation disorders. They start in tissue, not in blood. Years before your ANA turns positive, if it ever does, tiny nerve fibers throughout your body are being quietly destroyed. Your autonomic nervous system is being disrupted. Local immune attacks are happening in your glands, your gut, your skin, attacks that never register on a blood test because they are not producing enough antibodies to spill over into your bloodstream. Your blood test is measuring what's above the waterline. The disease is happening below it. Here's what makes this even more frustrating. We've known about this for years. Study after study has shown that patients with fibromyalgia have measurable small fiber nerve damage you can see on specialized biopsies, even when every standard blood test is pristine. Research has demonstrated that Sjogren's syndrome patients often develop neurological symptoms and autonomic dysfunction years before their antibodies ever turn positive, and in 30 to 40% of cases, those antibodies never turn positive at all. We call these patients seronegative. What that really means is, the test failed them. Not the other way around. Yet in most medical offices, a negative antibody test is still treated as definitive proof that you don't have the disease. That's like saying someone doesn't have heart disease because their heart hasn't stopped yet. We don't diagnose heart attacks by waiting for cardiac arrest. We look for warning signs. Risk patterns. Early damage. So why are we still diagnosing autoimmune and nervous system disorders by waiting for catastrophic failure? Now let me show you what changes everything. Because there is a way to identify these conditions early. A way to catch them years before standard tests would ever flag a problem. A way that has shown up to 94% accuracy in recognizing who is developing these disorders. And it doesn't come from a single magic blood test. It comes from pattern recognition. Because while each individual symptom might mean nothing on its own, when they appear together, in a specific combination, in a specific sequence, they form a fingerprint that's nearly impossible to mistake. It's not about any one signal. It's about the convergence of signals that show up consistently, across thousands of patients, long before formal diagnosis becomes possible. Think of it like weather prediction. A drop in barometric pressure doesn't guarantee a storm. A shift in wind direction doesn't guarantee a storm. Dark clouds on the horizon don't guarantee a storm. But when you see all three together, with temperature dropping and humidity rising, you know what's coming. You don't need to wait for the first raindrop to confirm it. These diseases have their own weather patterns. And once you know what to look for, you can see the storm building years before it makes landfall. Let me walk you through the 5 categories of early warning signs. The signals that appear, often for years, before standard tests catch up. Pillar 1. Neurological red flags. The earliest and most overlooked warning sign is often neurological. Not the dramatic nerve damage you see in late-stage disease. Something subtler. Something doctors rarely ask about. Burning sensations, especially in the feet, hands, or face, that come without any visible cause. Tingling that moves. Numbness that comes and goes. Pins and needles that strike randomly. Internal vibrations, the feeling that something is buzzing or trembling inside your body, even though nothing is moving on the outside. Temperature sensitivity that goes beyond normal. Feeling like your hands are on fire in warm rooms. feeling like your feet are encased in ice. Electric shock sensations, sudden, brief jolts that shoot through your limbs or trunk. And sensory overload, becoming overwhelmed by lights that used to be fine, sounds that used to be ignorable, textures that used to be tolerable. These symptoms often appear 5 to 10 years before any diagnosis. And they are almost always dismissed as stress, anxiety, or nothing. They are not nothing. They are small fiber neuropathy making itself known. Pillar 2, autonomic dysfunction. Your autonomic nervous system controls everything your body does without you thinking about it. Heart rate, blood pressure, temperature regulation, digestion, sweating. When small fiber nerves are damaged, these automatic functions start to malfunction. Dizziness when standing up, especially in the morning or after meals. Heart rate instability, racing heart for no reason, or heart rate that climbs dramatically with minimal activity. Heat intolerance that goes beyond discomfort, feeling like you might pass out in warm environments, or sweating abnormally. Gut dysfunction, bloating, constipation, or diarrhea that doesn't fit any clear pattern. Feeling full after a few bites. Nausea without explanation. Unexplained fatigue that doesn't match your sleep or activity level. These symptoms are often investigated individually. Cardiology for the heart issues. Gastroenterology for the gut. Each specialist finds nothing wrong in their domain. No one steps back to see the pattern. No one asks, what if one system is affecting all of these? Pillar 3, dryness patterns. Dryness seems simple. Obvious. Something anyone can explain away. Eyes dry? Too much screen time. Mouth dry? Medication side effect. Skin dry? Need better moisturizer. But the dryness pattern in early Sjogren's has specific characteristics that don't match simple explanations. It affects multiple areas simultaneously: eyes, mouth, nose, throat, skin, even when there's no medication to blame. It gets progressively worse over months and years, not better with simple interventions. It's accompanied by other symptoms, particularly fatigue and neurological changes that don't fit the simple dryness explanation. Dental changes appear, increasing cavities despite good hygiene, or unusual gum problems. Salivary glands become swollen or tender periodically. This isn't aging. This isn't dehydration. This isn't your medications. This is tissue under attack. Pillar 4, pain without inflammation. Here's the paradox that defines fibromyalgia and often appears in Sjogren's. You're in pain. Real, debilitating, life-altering pain. But your inflammatory markers are perfect. In classical rheumatoid arthritis, your CRP rises. Your SED rate climbs. You can see the inflammation in the blood. In fibromyalgia and many Sjogren's presentations, the pain exists in the nervous system itself. Its central sensitization, your brain and spinal cord amplifying pain signals even when there's no acute tissue damage. This creates a pattern. Widespread pain that moves, not fixed to one joint or one area. Morning stiffness that lasts longer than typical muscle tension. Pain that doesn't respond to anti-inflammatory medications, because it's not inflammatory pain. Deep muscle aching that feels different from injury or overuse. Tenderness at specific points that other people can touch without discomfort. When doctors see normal inflammatory markers with this pain pattern, many assume the pain isn't real. The pain is absolutely real. The markers just aren't designed to detect this type of damage. Pillar 5, the normal test paradox. And finally, the most counterintuitive signal of all. The pattern of normal results itself. Normal ANA. Normal SSA and SSB. Normal ESR and CRP. Normal rheumatoid factor. Normal thyroid. Normal vitamin levels. When someone has all the symptoms we've discussed, the neurological signs, the autonomic dysfunction, the dryness, the pain, and every conventional test comes back normal, that's not evidence of health. That's evidence that the testing is inappropriate for what's actually happening. You're using the wrong key for this lock. You're looking for the wrong disease with the wrong tools. And the normal results aren't reassurance. They're a diagnostic failure hiding in plain sight. Let me explain why this pattern emerges, and why it shows up before blood tests catch anything. These conditions begin with small fiber nerve damage. Small fiber nerves are the tiniest nerves in your body. They live in your skin, your organs, your glands. They control pain sensation, temperature perception, and autonomic function. When these nerves are damaged, whether by immune attack, metabolic problems, or other causes, they malfunction in specific ways. They send pain signals when there's no injury. They fail to regulate blood pressure and heart rate properly. They stop supporting the glands that produce tears, saliva, and mucus. Meanwhile, in conditions like Sjogren's, the immune system begins attacking tissue locally, particularly the moisture-producing glands. But here's the critical point. This damage happens in tissue. The immune cells are working locally. The antibodies are being produced locally. The destruction is local. And blood tests only catch systemic spillover. It's like trying to detect a leak in your basement by testing the water in your upstairs bathroom. The leak could be running for years before enough water rises to where you're testing. By the time SSA antibodies show up in your blood, your salivary glands may have lost half their function. By the time inflammatory markers rise, irreversible damage may have occurred. The pattern of symptoms we've discussed is the early warning system. The blood tests are the late notification. Now here's something most patients never learn. Specialists, the ones who actually focus on these conditions, have access to tests that can detect this damage years before standard blood work turns positive. These tests exist. They are validated. They are available. Your general practitioner probably doesn't know about them. Small fiber nerve biopsy. This is the gold standard for detecting small fiber neuropathy. A tiny punch biopsy, usually from the leg, is examined under specialized staining to count the density of small fiber nerves in your skin. This test can show objective nerve damage even when every nerve conduction study is normal. Because nerve conduction studies measure large fibers. They miss small fiber damage entirely. If your small fiber nerve density is reduced, you have measurable, objective nerve damage, regardless of what any blood test says. Autonomic function testing. Tests like QSART, quantitative pseudomotor axon reflex testing, measure how well your small fiber nerves control sweating. Tilt table testing measures how your cardiovascular system responds to position changes. Heart rate variability analysis shows whether your autonomic nervous system is regulating your heart properly. These tests can reveal autonomic damage that's invisible to any blood panel, and that explains symptoms patients have been told are just anxiety for years. Salivary gland evaluation. Lip biopsy is considered the definitive test for Sjogren's syndrome when antibodies are negative. A tiny sample is taken from inside the lower lip and examined for lymphocyte infiltration, direct evidence of immune attack on the glands. Many patients are diagnosed with Sjogren's through lip biopsy after years of negative blood tests. Salivary gland ultrasound can also show structural changes, glands that have become inhomogeneous or damaged, even before function is severely impaired. These aren't experimental tests. They are validated diagnostics. They're just not part of standard primary care workup. Here's how I want you to think about this. You've probably heard of a coronary calcium score. It's a CT scan that directly visualizes calcium deposits in your coronary arteries. It shows you actual plaque buildup, not cholesterol levels in your blood, not risk calculators based on age and weight, actual evidence of what's happening in your arteries right now. A person can have perfect cholesterol numbers and still have a high calcium score, because the cholesterol test measures what's in your blood, not what's already stuck to your artery walls. This scan changed cardiology. It gave doctors direct evidence instead of indirect guesses. The tests I just described are the fibromyalgia and Sjogren's equivalent of a calcium score. Small fiber biopsy doesn't guess whether you might have nerve damage based on symptoms. It shows you the nerve damage. Lip biopsy doesn't estimate whether your immune system might be attacking your glands. It shows you the immune cells in the tissue. Autonomic testing doesn't assume you might have dysfunction based on your complaints. It measures the dysfunction in real time. Yet most patients will see a dozen doctors and never be offered any of these tests. They'll get blood work. Again and again and again. And they'll be told they are fine. Again and again and again. While the damage continues. While the window for early intervention closes. While they lose years wondering if they're crazy. After 11 years of normal labs and worsening symptoms, Margaret finally found a physician who understood the pattern. Not a physician who dismissed her symptoms because her blood work was clean. A physician who recognized that the clean blood work was the problem, not the reassurance. This physician didn't start with more of the same blood tests. She started with a different question. What if we stop looking where the disease isn't, and start looking where it is? Margaret underwent a small fiber nerve biopsy. The results showed significantly reduced nerve density, objective, measurable small fiber neuropathy. She underwent autonomic testing. The results showed dysfunction in multiple autonomic domains. Her nervous system was measurably impaired. She underwent salivary gland evaluation. The ultrasound showed changes consistent with Sjogren's syndrome, changes that had been developing for over a decade while her antibody tests stayed negative. A lip biopsy confirmed it, lymphocytic infiltration of her minor salivary glands. After 11 years of being told nothing was wrong, Margaret finally had answers. Not perfect answers. Not easy answers. But real answers. Let me be clear about something. Getting a diagnosis didn't cure Margaret. There is no simple cure for these conditions, not yet. But diagnosis changed everything anyway. It allowed targeted treatment instead of random attempts. Medications that addressed nerve pain specifically. Approaches to manage autonomic dysfunction. Strategies to protect her remaining gland function. It allowed her to stop the relentless search for what was wrong, the endless doctor visits, the repeated testing, the constant self-doubt. It allowed her to focus on management instead of mystery. Most importantly, it ended 11 years of gaslighting. 11 years of wondering if she was exaggerating. 11 years of being told the problem was in her head. Sometimes the diagnosis itself is the treatment. Knowing what you're fighting gives you a way to fight back. Margaret's disease is still with her. It will always be with her. But she's no longer lost in the wilderness of normal labs and medical uncertainty. She knows her enemy now. And that made all the difference. Now I need you to hear something clearly. If you've been watching this video nodding along, if Margaret's story sounds familiar, if you see yourself in these symptoms, I need you to understand something. If you're waiting for abnormal blood tests to take your symptoms seriously, you may already be years into the disease process. Not weeks. Not months. Years. The average patient with fibromyalgia sees multiple doctors over 5 years before diagnosis. The average patient with Sjogren's syndrome experiences symptoms for nearly 7 years before accurate diagnosis, and that average includes the lucky ones whose antibodies actually turn positive. Seronegative patients? Many never get diagnosed at all. They give up. They stop fighting. They accept being told nothing is wrong. They live with progressive disease while reassured by labs that were never designed to catch what's actually happening. Early prediction is not about waiting for permission from blood tests. It's about recognizing patterns. Neurological warning signs. Autonomic dysfunction. Dryness that doesn't fit simple explanations. Pain without inflammation. The paradox of normal results despite clear decline. When these signals converge, they tell a story that blood tests miss entirely. The tests that actually detect this damage exist. Specialists who understand these patterns exist. Diagnosis is possible, even without positive antibodies, if you know where to look and who to ask. Document your symptoms. Learn the patterns. Advocate for appropriate testing. Don't accept normal labs as the final answer when your body is telling you something is deeply wrong. In the next video, I'm going to break down the specific tests that matter most, how to request them, how to interpret them, and how to find physicians who understand this approach. Because knowing the pattern is only the first step. Acting on it is what saves you years of unnecessary suffering. If this information was valuable, subscribe and turn on notifications. Share this with anyone you know who's been trapped in the cycle of normal labs and dismissed symptoms. This isn't rare. It's not unusual. It's just unrecognized. Until now.